تبص عليك وبعدين نروح ناكل. بخ لا قد كده.
لا بوكي.
ماشي ماشي. هي كده. انا هنا بس يلا. Okay, so hello everyone, this is Angelica again at the Osteopathy and Healing Center. So basically we're just going to demonstrate a treatment protocol for the lower limb if there's any orthopedic dysfunctions or issues. And I'm going to start off with treating the femur. So I'm checking here for the cranial rhythmic impulse. We already went through the general assessment protocol, so same thing. You're checking for the internal or medial rotation and external rotation of the femur. Now in this case at ease, that's perfectly fine. Don't forget, we've got two limbs, so check both of them. And here on this left side, I'm finding that the femur is not going into medial rotation. So I'm just holding. We're going indirectly into ease and waiting for a release. And you can also specifically feel, is the medial restriction more distally or proximally? So it'll tell you if there's more issues with the knee, if it's distal, or if it's proximal, if there's more issues with the hip. So what I'm finding is more distally, there's medial restriction. So that's going to be important to note, because later when we check the tibia and the fibula, we'll see if that pattern of restriction follows down into that area as well. Okay, now we're going to treat the tibia. So again, earlier in the previous video, we checked, our hand was on the tibia for that medial internal rotation and for that external rotation. And if we find there's restriction, we're going to hold for release. And with this right leg here, I'm actually finding, just ease out and keep the leg straight. I'm finding there's really good movement. There's no restriction. Interesting. On the left side where we had the issue with the femur, I'm also finding there's restriction with the tibia. Same movement in flexion, or I should say moving medially. Internal rotation. So I'm going into ease and I'm holding. I'm just waiting for it to release. And I'm finding this at the proximal end of the tibia. So there's more issue going on at the knee here, not at the femur for femoral anteversion. Again, the kids, they will move around, so you just follow that and keep releasing. So this is treating the tibia. And you'll notice that there is like about 15 degrees of normal external rotation of the tibia. Good, and that's the release there. Again, we reassess, we're good. Now I'm going to go and check the fibula. So again, we're checking if there's the motion of the fibula moving up, down, and like a seesaw, both proximally and distally, and if there's that figure 8. And it's okay on the right side. And on the left side, it's okay just when I feel the craniorhythmic impulse. The fibula on the left, the distal portion is restricted. So I'm going to just follow that craniorhythmic impulse. And as you follow it, you'll find that there is the release of the fascial tension and the restoration of the craniorhythmic impulse. Okay, so we treated the femur, we treated the tibia, we treated the intra-osseous membrane, that last technique, between the tibia and fibula. And on the previous video, we were releasing the entire leg and the hip. So you're moving with the child's leg. Wherever you feel that there's any fascial restriction, you're just gonna move and you're gonna release that ankle. Oh, let's keep you on your back. Just go on your back, Isa. That's it. Okay. Okay, we're gonna take a break. Okay. That's fine. I just don't want him to fall. Do you have him?
Yeah.
Okay. Okay, good. All right. I'm gonna stop the recording.